It's a pleasure and honor to be with my colleagues on this panel, many of whom I've learned from and admired for their work on this topic. It's great also to see a lot of friends and colleagues in the room, people who've been interested in this issue and have been doing a lot of work on the ground trying to save people's lives. So thank you all very much for the work you do. So I'm going to talk a little bit about gun violence trends and data infrastructure. And data infrastructure is not the most exciting topic in the world, but we have to talk somewhere. The nation's crime data infrastructure comes from primarily 3 federal sources and 1 non-federal source. The first federal source is the FBI's NIBRS system, the National Incident-Based Reporting System. As all of you know, the FBI transitioned from the summary reporting system to the NIBRS system in the fall of 2022. It did not go as everybody expected it did with the first rollout, and that led to not a large percentage of reporting agencies compared to the past. NIBRS, however, has a promise that it includes all of the incidents that occurred in a particular crime event, which is more than the standard reporting system, which only collected the most serious event. NIBRS also does collect gun data. It includes whether or not a firearm was used in a crime, but those fields are not always populated the way that other fields are in the NIBRS system. And of course, as everybody knows, crime data in this country is still voluntarily reported by the 18,000 some odd law enforcement agencies. The second principal source of data collection on guns comes from the BGS National Crime Victimization Survey. This is a survey of over 200,000 persons and over 100,000 households aged 12 and older. The problem with NCVS is, of course, it only includes people who are alive, so we don't have data on fatal shootings, but we do know if a gun was used in the actual victimization experience. Both of those data collections are housed, of course, within the Department of Justice, but they straddle 2 different time periods. The FBI data is a calendar year data, the NCVS straddles 2 different years. The third final source of federal data collection comes from the CDC. The CDC's Wonder database and the NVDRS contain information on homicides, and there's a flag in the homicide for whether or not it was committed with a firearm. The other thing that's really good about the CDC data is it actually has information on demographic characteristics, and I'll go over that, some of that detail with you in a little while. The last one is the Gun Violence Archive. This is an independent set of researchers who put this data set together that basically scours the internet, law enforcement sites, and news media on fatal and, most importantly, non-fatal shootings. And we know there's many more non-fatal shootings than there are fatal shootings, but the other data collections don't measure that. So the GVA has gotten better over time, and it's much better when you look at it at the big city level than when you do at the local level. This, of course, led NORC to make a statement in 2019 about the nation's gun violence infrastructure. And basically, they have a nice report called A Blueprint for a U.S. Firearms Data Infrastructure, and their entire summary is basically this. The nation's gun violence data infrastructure is segmented, it's varied, and it's all over the place. So you could look at one data set and get one set of results, and another data set and look at another set of results, and then you're left with 2 different answers. And of course, which one is the right one? One never knows, except for one's political point of view. So this is a big problem. We know the U.S. has a gun violence problem. We also know the U.S. has a gun violence data infrastructure problem. So I want to do a little bit of just level setting with what we know from the GVA with respect to fatal and non-fatal shootings, and then I'm going to talk about 2 different studies that I led that might be of interest to people in the room using the various data sets I talked about. You see 2 graphs here. You see the blue line, which is gun deaths, and then the orange line at the top is gun injuries. What you see also is that increase that we saw in 2020 and 21 with respect to fatal and non-fatal shootings throughout the United States, and then the precipitous drop down. That period of time in 2020-21, that was the single year of the highest homicide increase in the United States since 1960. And now it has started to come back down. Now, this is a national number, and remember the national number because I'm going to come back to this in a second. I want to highlight a paper that John Roman from NORC and I published in JAMA Network Open. And what we did here is we were interested in disaggregating the demographic differences in firearm violence before, during, and subsequent to the COVID-19 pandemic. And again, this uses the CDC Wonder data set. And we were primarily interested in whether or not there were Black, Hispanic, white differences, and then broken down by age groups in that time span. All right, there's several findings in this paper, but I'm going to show you the most depressing but most glaring finding of this paper. What you see there is in the year 2021, for those individuals aged 15 to 19, when you calculate the ratio of black to white firearm homicide victims, the ratio is 27 to 1. Just take that for 1 second. For every one white individual between ages of 15 and 19, there are 27 black individuals who also suffer from firearm homicide victimization. In a second paper, two of my colleagues from the Center for American Progress, Nick Wilson, I think, is in the room. Nice to see you there. We were interested in another question. We know there's demographic differences in homicide victimization throughout the COVID period, but now we wanted to see whether there was variability in the nation during that time period. Everybody talked about the national numbers. National number this and national number went that. My mom, who lives in the middle of Florida, is not going to care what's happening in the nation. She wants to care what happens in her particular city. So what we did is we used data from the Gun Violence Archive, and we stratified the data set by looking at 88 of the largest cities, over 250,000 people. We also used a very novel methodology. Since we have 88 cities, there might be some cities that look more alike than other cities in the data set. So we used something called a group-based trajectory methodology that looks at each city's violence over time, and then it lumps cities that look more like one another into one group and other cities that look more like another to another group. And so cities are identified and put into the group to which they have the highest probability of belonging to. I could talk more about that for the nerds in the room later on. So here's what you see. We basically identified 5 groups. This is the period of time, March 10th, 15th is when the world shut down. Everybody's probably forgotten that out of their lives. And then we look at that trend over time. What you see here is that the national number didn't happen everywhere. So the surge and the timing of gun violence varied across cities in the United States. Chicago and New York, what you see right there in New York City, had the largest increase, over 3,000 more firearms shootings and deaths during the period of time of COVID than the year before that. So the gun violence problem is a demographically isolated problem, and it's also varied across cities in the United States. So when we think about a gun violence problem, it's about people and it's about places. So going forward, I want to highlight some of the work that the White House Office of Gun Violence Prevention did under the leadership of Rob Wilcox and Greg Jackson. They actually, in a little over a year's time, were instrumental in helping us get better data in what they've done. So NIBRS now will have an improvement that's supposed to start this summer to actually flag gunshot injuries in the victim segment of the field. Whether or not it happens in June 25, how much of that gets populated by law enforcement, that's a different issue, but at least we're moving in the right direction. The second thing that the office was also able to do was they work really closely with the CDC to improve their data visualizations. And now you can, at the census tract level, get information on suicide, overdoses, and homicide in the CDC data. The non-fatal injury from gunshot data is not yet out from the CDC, but there's movement also in that direction. So there's better data coming. I wish we were here now, but it's coming, and that's a large thanks to the hard work that the office put together for all of us to have going forward. So to end with 3 bullet points, I think we need to encourage routine collection of fatal and especially non-fatal gun violence data by law enforcement agencies. Some agencies do that already. Some of them put it on their dashboards, like the Boston PD. Others, it's not there at all. So I think in this day and age, where we get information in 2 seconds on our phone, I think the onus is on law enforcement agencies to do that. Second, encourage real-time publication of fatal and non-fatal gun violence data. We live in real-time data world. You know, everybody tracks things on Flight Tracker. We should be able to do the exact same thing with gun violence data. We need to encourage that and not wait a year of time for that data to come out for people who are doing the work down at the local level. And last way, integrating federal public health data and criminal justice data. That's a no-brainer, but we haven't done that yet, and we need to do that now going forward. Thank you very much for your attention. Appreciate it.